A month before she died, Alice told her GP, "I've been on the gender identity clinic waitlist for over 2.5 years with no end in sight. I need an appointment. I am struggling. I am concerned that I have missed out on vital treatment. I often feel hopeless and helpless, and life is not worth living."
Alice Litman's family wanted to be remembered as bold, brave and kind. But they also want to stop any other trans person going through what she did. She'd spent over 1,000 days on an NHS waiting list for trans-affirming healthcare, but would still be waiting to be seen today if she hadn't taken her own life in May last year.
Nothing will bring Alice back, but if we can just help one person in the trans community to live a better life and to access the care that they need, then we've done something.
Today at Alice's inquest, the coroner issued a rare prevention of future deaths report to NHS England, Tavistock and Portman Gender Identity Clinic, Surrey NHS Trust and the Royal College of GPs to try and change outcomes for trans people.
The report lays bare the gaping holes in trans healthcare provision in England, raising concerns about the long waiting lists and lack of mental health support during that wait, but also highlights a lack of general training and clarity in mental health care for trans people, as well as a lack of clarity for GPs on how they can best support transgender youth.
The most important thing that came out at the inquest was that the Gender Identity Clinic acknowledged that if someone was referred today, with the number of patients they have on their waiting list and the rate that they are seeing first appointments, it would be 20 years before you received your first appointment. And I think a figure like that just means that the services are functionally non-existent.
The organisations involved offered their condolences to the family and said they will address areas of concern. NHS England says it's working hard to reduce waiting lists across both adult and children's gender services, which they say has increased due to a rapidly rising demand and a shortage of specialist clinical staff.
How do you all remember Alice?
She was just a delight, and I just adored her.
We were so close as a family. And she was just part of us. She was part of our lives. And I thought she would be forever.
This isn't the first inquest to address this issue, and unfortunately it won't be the last, but maybe it will be one of the important ones to change hearts and minds.
Anya Pop reporting from Brighton. And if you've been affected by any of the issues discussed in that story, you can find guidance and support at channel4.com/support.